Watch your mouth.
All right, we are back with HTV's dental expert, Dr. Ryan Walker. Doc, good to see you again.
Good to see you, Martin.
We've talked so much in this program about taking care of your teeth and what to do to keep your teeth, but there's a certain population that have lost their teeth.
Yeah, for some.
So, but there's possibilities with that too that I know that you could help people out.
Yep, for some people it's too late, and for those people you got to help. Statistically speaking, 4.9% of adult Americans have no teeth at all. So in Terrebonne Parish, that means percentage-wise, you're looking at about 5,000 people in this parish with no teeth.
Wow. And I guess there's a lot of different things that contribute to that. We could talk about a lot of them, but I'm sure sugar is one of them.
Yep.
I'm sure crystal meth is another.
Drugs, gum and bone disease, all of the above.
Yeah.
Trauma.
Right. And so, but nationwide, 12.8 million. That's an incredible number.
Yep. Yep.
Yeah. So part of your job is not to just educate people who have their teeth, but to try to see if somebody qualifies if they do not have their teeth. When somebody walks in and says, Doc, I'd like you to maybe help me with dentures or different things, is there a certain percentage of those that you can help and some you just can't?
No, I mean, there's a solution for everyone.
Okay.
And, you know, there's really a solution for everyone. There's really no excuse for people to not have teeth, because it's more than just aesthetics. It's function also. You know, if you don't have your teeth, you're not going to be able to eat the diet that's going to be healthy for you. It cuts out proteins and fiber, which is really, you know, some of the healthiest things you can eat, and your diet goes to more of a liquid diet, which is really not healthy. So it's quality of life, really. Confidence, quality of life, there's a lot to it. Yeah.
Let's bring up a picture. I know you developed some of these, and we have them. And a lot of people call these false teeth, but isn't that just a bad way to describe something?
It's dentures. I mean, it is what it is. For us, it's prosthodontics. You know what I mean?
Yeah.
It's just giving people their teeth back.
We ought to call it new direction teeth or
Right.
something like that. Yeah, put people on a new direction. But doesn't it help people's self-esteem and everything?
Absolutely. Yeah, everybody, and you know, even people that do have dentures, some people, if you look in the mirror and you think, man, these just don't look natural, there's really no excuse for that. It's just a matter of setting up teeth. The sky's the limit, really, when it comes to replacing teeth and prosthodontics. There's really no excuse for a bad smile and low self-esteem or low confidence.
Do you ever do maybe just upper and just lower, or is it always both?
So, no, it's not always both. Actually, if you can keep the lower teeth, it's much more advantage to keeping them, because the lower denture is really difficult to deal with. An upper denture typically is going to function pretty well. If you saw the picture, the upper denture is the bigger one, and it forms a suction on your palate. So upper dentures, even though they are what we call tissue-borne or just sit on the gums, it forms a suction, and they typically work okay. The lower denture is always going to be the problem. The lower denture is what patients are always going to complain about. And, you know, you always hear this in dentistry that, you know, a lot of people, their lower denture just lives in their top pocket. And I've always heard that, but until recently, I was actually at the grocery store, parked next to this lady, loading up my groceries, and I look over, we talk a little bit, whatever. I get in my car, she gets in her car, I look over, bottom denture comes out in the purse. So it's real. The lower denture is really just, because it can't form a suction, all it sits on is the bony ridge in there.
Yeah.
The tongue prevents you from having that, you know, the palate like the upper denture, and it just floats. It's just really hard to deal with.
Let's pull up slide number 2 if we can, Jason, because I was asking you prior to the show, these look like snap hooks.
So those are what we call abutments. Those are abutments that go onto dental implants, which are just roughened titanium screws that go in the bone. And this is really the biggest game changer in a lower denture. I mean, this has really changed somebody's life. It takes that lower denture and takes it from floating around in your mouth to actually just snapping on. We put these little attachments in the lower denture, and that lower denture snaps on, and it does not float around.
And it seems so simple, But it took a while to develop that, right?
Yeah, it's been around for a little while, but it's really it really does change people's lives. And when you do this for somebody that's been wearing that lower denture, and all of a sudden it doesn't come in and out their mouth as easy, it doesn't fall out, they can chew with it, they can speak, smile, it really does make an enormous difference in somebody's life.
When you see somebody and you're able to help them with dentures, and let's say they've gone 3, 4, 5 years, maybe longer, without teeth. It's got to make you feel good when they see the final product and they just walk out beaming.
Yes, it just does so much for their self-confidence and their self-esteem. They smile. They can't help but to smile. Even somebody that's not, they probably spent years, if they didn't have any teeth, not smiling, and all of a sudden now they can smile, and they should look natural. It shouldn't look like, oh, what's in your mouth? It should be, oh,
Should look like that.
I can't tell. I really can't tell. It just looks like a nice, natural smile.
So real quick, if somebody is watching and they've been struggling and don't have any teeth, want to get themselves a new set of teeth, come by and see you.
Yes, sir. Please.
You'll
That'd be
consult
great.
them and try to help them out.
We can help them. Yes,
All
sir.
right. Dr. Walker, good seeing you again.
Thank you so much.
All right, there you have it. Our dental expert here at HTV, Dr. Ron Walker. We look forward to him bringing us great information each and every week, and that he does. And he's helped many, many people in the area, and we look forward to him with these topics helping a lot more. I'm Martin Falls. We'll see you again next time with Dr. Ron Walker. Have a good night.
Watch your mouth.